I am a registered nurse.
I am a dietitian.
I am a physician.
I am a social worker.
I'm a clinical pharmacist.
Interprofessional education occurs when different health and social care students learn about, from, and with each other. Here at LAU, we offer interprofessional education to all our health and social care students. These include 5 professions: medicine, nutrition, nursing, pharmacy, and social work.
As a registered nurse, I care for people. I prevent their illness by educating them. I treat them in their acute stages of illness, and I help them regain functionality and advocate for their needs.
Dietitians are health professionals that assess, diagnose, and treat nutritional problems. Often we work in hospitals and private clinics as part of the interdisciplinary team to treat complex clinical conditions.
Patients are usually referred to us upon the request of any medical staff member working in the hospital. We work on assessing the patients on 3 aspects: socially, psychologically, and financially.
I round on a daily basis with the ICU team, so I'm always available to provide drug-related questions. I also conduct daily medication reviews to make sure that all the medications were ordered, dispensed, and administered correctly.
As a physician, I take a history from a patient and do their physical examination in order to make a diagnosis and a prognosis of how their disease course is going to progress. And I have to make complex decisions in situations that might be critical or uncertain. And finally, I educate and train the next generation of physicians.
We offer 2 types of interprofessional education activities. The first are the IPE steps. These are the didactic activities. We have 5 half-days, each have a theme, such as communication, conflict resolution, ethics. It starts off with a very large information session in which all students are grouped together, but then there are breakout sessions in which interprofessional groups of students, small groups, can solve cases together collaboratively. The second type of IPE activities that we offer are really to take IPE out of the classroom and into a setting that is closer to real life. These are our practice IPE activities. They include health awareness sessions in malls or public places, as well as simulation of patient cases in our clinical simulation center here in Byblos.
It is my passion. I find self-satisfaction and comfort in helping others and seeing my patients making it safely through their hospital stay. And working as a clinical pharmacist gives me the opportunity to work closely and collaborate with other healthcare professionals.
We collaborate in almost all stages of the patient's care. What I have seen the most critical areas are, for example, in urgent situations in the operating room or the emergency room, where the doctor must communicate with other doctors, nurses, and technicians to prevent errors from happening, which sometimes can be tragic.
If a person is getting hypertensive and their blood pressure is getting out of control, I'm the person to recognize it and I need to act instantly. I need to call the physician if I have no medication to control that blood pressure. The pharmacist would need to be available to provide the medication in time and to provide the correct medication.
It's really important that all the members of a multidisciplinary team are all on the same page, because a slight miscommunication or no communication at all always leads to medication errors and to patient dissatisfaction.
And that person might have deteriorated either because they weren't maintaining their nutrition, let's say, they were eating too much salt. We need a dietitian on board to help them prevent such occurrence again.
Compromised nutritional status leads to a depressed immune system, poor wound healing, as well as it slows down the recovery process. So it's extremely important to collaborate with the team and intervene appropriately in order to speed up the recovery process and discharge the patient as soon as possible home.
A social worker might be of help if the patient cannot afford the medications that they need to take.
If a patient suffers from anemia and he's not able to afford buying his medication because in the first place he's not able to buy food for the children, we work on providing him with the medication. Also, we work on providing him with the side that would help him afford buying the food for the children.
So we all do our own assessment based on the perspective of each and every one's discipline, and then we bring it all together during rounds to come up with a shared common plan, which we communicate eventually to the patient.
So if we're not collaborating and communicating, if we're not frequently working as a team, the patient is the main person that will be affected.
Interprofessional education is learned to lead to better collaboration in the workplace and to better health outcomes. And by this I mean shorter hospital stay, less medical errors, and more patient satisfaction. And this is definitely our common goal as health and social care professionals.
We all feel very proud when we receive a patient who is critically ill, who we may think may not make it, but eventually gets discharged or gets transferred in a stable condition.
We all have a role in helping that patient out.
You should try to benefit the most of your IPE experience. Not many universities offer IPE. We are the pioneers of it in Lebanon. It is a unique opportunity for you to meet and mingle with the other healthcare professions. These are exactly the same professions that you will be working with later on.